These majestic creatures are believed to be spreading Middle East Respiratory Syndrome, or MERS. The virus was first identified here in Saudi Arabia in 2012. Around a third of those infected die. This lab in Oxford is developing a vaccine to protect people against MERS. It's one of the most advanced versions out there. If this vaccine does work, it could still take a decade or so to get it to those who need it. Historically, money for these obscure viruses hasn't been forthcoming, and the regulatory process is long and complex. Scientists are also developing vaccines for Nipah virus, which has killed around 300 people in Bangladesh, and Lassa fever, which already claims 5,000 lives in West Africa every year. The research charity The Wellcome Trust is part of this new coalition, which aims to develop and test vaccines for these three viruses within the next 5 years.
We've got lucky so far, but the world has major gaps for infections we know about, which could cause Ebola-like events, but then spread around the world very quickly. And that puts the world in a very, very vulnerable place.
There's no way to know which virus will strike next, but it's hoped that putting time and money into developing new vaccines now could stop the next small outbreak becoming the next global health emergency. Tulip Mazumdar, BBC News.
And after 7, we'll be speaking to a professor of infectious diseases and global health about the research. That's at about 7:10 this morning.